We're going to go ahead and get started, and welcome to the second session of the UCSF Innovator Seminars. We have people on Zoom, we have people in the room, we have people on their way. We're going to go ahead and get started though, because we've got a pretty full session packed session for tonight, and we don't want to miss out on any of it. So my name's Einor Sawyer, my colleague Nate. Would you pronounce your last name for us, Nate?
Pro-Rock.
Because I learned I was saying it wrong. Pro-Rock. And our leader, Peter Katsanis from Innovation Ventures, are here tonight. We're hosting this session, but it's a joint effort between a lot of innovation leaders on campus, and we're really excited tonight to have Dr. Han-Min Lee with us, who's head of pediatric surgery, but he's also head of surgical innovations, Pediatric Device Consortium, and he's been a great innovative frontline innovator at UCSF for a long time and a mentor to many of us. And he's also the inventor on the interactive experience tonight. We're happy to have his technology be put forward into the workshop session that we're going to ideate on a bit, see if we can think of anything he hasn't thought of, which is unlikely, but it's possible always. So let's move forward then. The agenda is quite simple. We're just going to have a really great presentation on different aspects of design thinking and tools of the trade that you can actually start deploying as soon as you log onto their website. But this team is also extremely rich in expertise, and you can have opportunities to work directly with them, and you'll hear about that tonight. We'll have Q&A, and then we're going to have an interactive session. The people on Zoom can participate on Zoom, and the in-person people will go up to the Innovation Lab, and we'll do some workshop up there. And I first want to just say that we have institutional level commitment to innovation at UCSF, and a quote from Catherine Lucy: UCSF's top priorities include inspiring, identifying, and investing in frontline innovators who are translating novel ideas into beneficial impact at scale for healthcare and life sciences. So we've got institutional level support, but like all frontline innovation programs, we have challenges still moving from idea to impact. And so particularly for the innovators, we want to make it a more streamlined, easily navigable process. So that's really why we're building the Innovator Seminar series. We also want you to get recognized for it so it matters in your career development, and we're creating curriculum. This is the pilot. This series is a pilot for a curriculum and a certificate program that we're building. So stay tuned for that, and also give feedback to inform that. I also want to say that our leader in Innovation Ventures is fully committed to developing methods and programs for early identification of frontline innovators. So we have a range of people who sign up for this course, from pre-innovators to serial innovators. And we're hoping to give a broad curriculum that's also deep, so that people at any stage in their career development as an innovator, a frontline innovator, a clinician innovator, or scientist innovator, even an educator innovator, will have something to gain from the sessions that we put on. So in Innovation Ventures, we do try to help you move from idea to impact. And we do that through helping you identify when you have an idea to discovery, an idea or discovery that should be disclosed, how you do that. And we help vet which ones of those are protectable in a patent process or some other way. And then we also help move that along the translation pathway towards dissemination, or what we call towards impact or commercialization, if that's the route that it goes. But there are many options, so we try to help facilitate that. We have several sectors within Innovation Ventures. That's always confusing for people: Office of Technology Management Advancement, Office of Strategic Alliances, Catalyst, and Vent Funding. You'll hear a little bit about. The Innovator Enrichment Program is new, and the Entrepreneurship Program many of you are familiar with, and I think enrollment is happening right now, and that's Stephanie Maris's course on global entrepreneurship. Be sure to look for that on our website as well. And then the Catalyst program, which many of you heard about, it's really our internal accelerator program. And I've been involved in it in the past. Nate's certainly key in coordinating that. And they'll have an opening announcement for another cycle in August, so watch for that. And it'll come out in association with the RAP grants. But also right now, you can apply right now to have a UCSF Catalyst summer internship. So I want to make sure that you're aware of that. And I think it looks like the deadline may have been extended, or is it hard? Yeah, they're going to move the deadline out a little bit, but it's a few days from now. So Innovation Ventures is a real hub of innovation activity, but not the only innovation activity at UCSF. We have over 20 innovation initiatives at UCSF, but they're really hard to understand and to navigate as to who does what. So we're also going to be helping you understand that tapestry a bit more in this course. But again, we're very fortunate to have a leader of at least two of those initiatives right here in the room with us tonight, Dr. Han-Min Lee. In all of this, though, we've heard many times that it's still hard to be an innovator at UCSF. And it is. We have pathways and formulas and roadmaps for how to be a clinician, a scientist, and an educator, but not for an innovator. And I'm looking at Tom right now, who I first met as a med student here in the health tech elective, and he's informed my teaching of this. He's now a surgical resident here, but he has across the board been a frontline innovator. And so we're learning from his process where we need to make that pathway, create more fertile soil for that, but make it more navigable. So we've built the Innovator Enrichment Program. This is actually new, and we're going way upstream on innovation, not waiting for them to come to the door as disclosures, but we're trying to identify innovators early or pre-innovators and their innovations that look promising so we can add support way upstream. And in fact, one of the things I keep saying to Peter is no bees, no honey. So here's a picture of going upstream with bees. I was happy to find that. So we're really looking to keep up our reputation, but expand our reputation of UCSF as an innovation leader in academic medical centers and healthcare delivery systems. And we want to diversify our innovator community and also the targets of our innovation. And we've been doing research to profile that so we have metrics to work against. We want to inspire, identify, and invest in our frontline innovators, and then also create a rich innovator experience at UCSF, an environment and an ecosystem so that we can recruit and retain the most talented people for the work they're doing in clinical research and education, but also that allows them to explore and expand their innovation development. And then we want it to also be a learning system so that we can keep monitoring. The first session was held in April, and that was a very exciting session where we did an introduction of a lot of the programs and resources available. We'll go back to those as they become timely, as the deadlines open and close. We'll keep letting you know that. But tonight, I'm really happy to introduce the session, which is Design Thinking and Tools of the Trade. And this team is something that is a gold mine at UCSF, but a bit of a hidden gold mine. So I really want to let you know who these people are and what they do. And this is the UCSF SomTech office or School of Medicine. And these are the design experts. And they're going to present to you tonight from their deep experience, not only from their background outside of UCSF, but what they've done while they've been here, helping people come forward with their ideas, help them move across the opportunity roadmap, and really get something on paper so they, first of all, they can apply for a grant and be more successful. They can build a budget that makes sense and includes the design thinking aspect. And part of what they're going to do tonight is help walk you through what does that mean? How do you get from taking your idea and putting it into a process that's going to ensure success at the end? And some people bring in design way too late. So we're bringing it in the second session of this curriculum. So I'd like to turn it over now. Our cast of presenters tonight, we're extremely fortunate. We have Jonathan Prug, Anna Buenaventura, Svetlana Milter, and Cynthia Milonis. And these names will all be said correctly by Jonathan in just a few minutes. Thank you so much. We look forward to this.
Hello, welcome tonight. I am Jonathan Prue. I am the Interim Deputy Director of the Design and Discovery team at SomTech. And as Einar said, we're going to be sharing the presentation duties tonight, but we are really excited to be here. I have my colleagues, Anna Buenaventura, who's a Senior UX Designer, Svetlana Milter, who is our Business Solutions Architect, and Cynthia Miliones, who is another Senior UX Designer on the team. Thank you for having us, Dr. Sawyer. This is an exciting opportunity, and looking forward to walking you through some human-centered design. Before we get started, I wanted to take a quick poll. There's not that too many people in the room, but online as well, and hello to the Zoom folks. How many of you have or are using human-centered design in your work currently? Excellent. And do we have any researchers out there? Have any of you written human-centered design into one of your research grants? Well, maybe some opportunities there if when we get through this presentation. So here's what we're going to be talking about today. I'm going to do a quick intro to just SOMTech and what we do. I'm going to touch on digital product development at UCSF and some of the challenges that are unique to this institution. I'm going to give an overview of human-centered design and why we think that's an important aspect of product development. I'm then going to hand it over to Anna and Lana, who are going to walk us through SOMTech's design and discovery process, and this is how we implement human-centered design in our work. And then Cynthia is going to walk us through the product toolkit, which are some tools that you'll be able to use to incorporate HCD, which I may refer to human-centered design as in this talk, in your own work. We'll do a Q&A, and then we'll do a design activity at the end, which I think will be a lot of fun. So SOMTech sits in the School of Medicine Dean's office. We're in sort of an internal consulting group that works across the School of Medicine, creating digital products, helping people meet security needs, and supporting business strategy. And we work on a project-by-project basis typically. We collaborate with researchers, faculty, clinicians, other innovators like yourself. And really our goal is to help them make their technology vision concrete and tangible, so they can move forward with it. And as you all know, UCSF is a pretty complex place and requires a lot of navigation to get anything done here. And we help guide our clients through this complicated ecosystem. We have a really broad knowledge of how to get things done. We're also one of the few groups on campus that does human-centered design, which makes us somewhat unique. And this is what we're going to talk about tonight. Before I do, I just wanted to introduce you to the SOMTech team. We're about 25 people. We have a diverse range of roles that you can see on the slide there. And we're really flexible in how we can structure our project engagements. And we have most of the skill sets in-house, which is really valuable and helpful when we do that. We're talking about human-centered design today in the context of digital product development. But human-centered design can be applied to a lot of different fields, like service design, or education design, or civic design, which just so it's not just products, but that's what we're talking about today. And building digital products at UCSF poses some challenges. The people we're designing for are not your typical consumers or general public. We're designing for patients. We're designing for clinicians. We're designing for underserved communities in the area that researchers are working with, and they have their own unique sort of needs and challenges. We also work a lot, of course, with PHI, and we have to always make sure that we're protecting that data. The technology landscape at UCSF is also pretty complicated. There's many systems out there managed by different groups, and again, that navigation piece that we help guide people through is part of the work we do. We work with Epic that has its own list of constraints, of course, and we're always considering security and compliance in the work we do. And finally, we need to do all this sort of within the wider context of UCSF's strategic goals. So why do we think human-centered design is important? Why do we use it? Human-centered design puts people at the center of problem solving. Human-centered design prioritizes the needs and preferences of the people who are going to be using our products. It gives us the tools and methods to sort of effectively communicate and learn from our end users and our product owners and our product team and all the other stakeholders that we're working with. And it allows us to quickly test our ideas and iterate our designs. So I'm going to spend a couple minutes kind of walking through the benefits of human-centered design and why we think it's important. So first and foremost, and perhaps most importantly, human-centered design facilitates conversations and collaborations. This is a big part of what it does. It helps you have the right conversations with the right people at the right time of the project. And you'll see on the screen at the top, there's the success metrics graphic. That is taken from our product toolkit, and that really allows us to have conversations with the product owner about defining what do they mean by success? How are they going to consider their product a successful endeavor? And how are they going to measure that success? And these are important things to consider when you're building a product. The brainstorming graphic is from a workshop we did with caregivers around medical appointments and managing that. And again, this is facilitating a conversation. We're structuring this conversation so we can capture their thoughts and ideas, and then we'll later synthesize those and use that to inform our work. And the image on the right is what we call a vignette, and we use these to really have those conversations about context, the context of use. Because if you're going to introduce a digital product into, say, the operating room, you want to make sure it's not making things worse. It has to play nicely with everything else that's going on in the room. Human-centered design provides ample opportunities for feedback. We do one-on-one qualitative interviews with our end users to understand their needs and preferences. We bring those users in to co-design with us, to get their ideas down on paper, to help shape the product. We bring stakeholders in to do the same thing. We create these sort of comic book looking scenarios or storyboards, and this really helps us think about the context of use, where this product's going to be used, how it's going to impact the workflow that it's being introduced into, because these products don't sit in isolation. They have to play nicely with other things that are in the context of use. Human-centered design reduces cost and mitigates risk. This is a big one. Writing software is expensive. Having to go back and rework your code because you didn't get it right the first time, that really sucks. And it's going to cost you money. It's going to push out timelines. It's going to make a lot of people really grumpy. And it may even set you up for failure. So before we start writing software, we do this. We use paper prototypes and low-fidelity mock-ups. These are quick to produce. They're easy to throw away. People don't get too attached to them. They don't get, they're not precious, right? They're stuff that is disposable, and we can get quick feedback and iterate on the designs and move towards sort of the final product. And we sort of repeat this process throughout the design phase. We sort of move up in fidelity or up in refinement in the designs as we go, and we're getting feedback, and we're sort of honing in on what the final set of features, interactions, and all that are going to be. We usually get to a point where we even create clickable prototypes, and these are designs that you can load up on your screen, and the users can click around, and we can test the user interactions in the interface. And still, we haven't written any code yet. So when we do hand off to the engineers, we have a much better chance of getting it right because we've done all this pre-work. And this pre-work has not cost that much money, and it gets us very close to what we want to build. Human-centered design promotes inclusion. Engaging with our users throughout the process, again, over and over, we're putting designs in front of them, we're getting feedback. This gives us the opportunity to identify where exclusion is happening, where people are being left out of this product or this process. And then we can adjust our designs accordingly. This storyboard that you see up on the screen came out of a workshop that Cynthia and I ran with pediatric liver transplant clinicians. And we learned in this conversation with them in this workshop that there was a need to communicate with caregivers who may not be familiar with Western medicine or with how our health system works. And so we created this communication guide to help them have those conversations and help guide those caregivers through this transplant process. And the outcome of our discovery work will typically lead us to the definition of a minimum viable product, or MVP. This is sort of the point where we're going to hand it off to the developers. But the idea behind an MVP is to get a product, working software out into the world that's functional from a technology standpoint, that's reliable, that's usable and useful in whatever context you're designing for, and that it has some emotional resonance, that it's fun to use or a pleasure to use. And an MVP may not have the full set of features that you've envisioned at the beginning, but that's okay, because you want to get this out into the world, into people's hands, so they can start using the software, and you can continue to test in a real-world context. And then we can continue to iterate on features and functionality. So you may be seeing a pattern here where we are making something, and then we're testing it, and then we're learning a bunch of stuff, and then we're going back and we're iterating on what we've done. And that's really the crux of human-centered design. And then we can add these additional features that we discover in this testing, in the next phase of the project. We put them on the roadmap, and we make sure we're building the right thing. And so that's where I'm going to stop. I'm going to turn this over to Anna and Lana now, who will walk us through our design and discovery process. And again, this process is how we implement these sort of principles of human-centered design in our work. Thank you.
Thanks, Jonathan. That was really hard to beat, but I'll try my best. So Jonathan talked about the minimum viable product, but how do we actually get to this MVP? And this is where our discovery and design work typically comes in. So this is where we begin. And we typically use this framework called the Double Diamond Framework. This is not the only framework that exists out there. There's lots of different frameworks, but this is a widely known and very common framework that's being used in human-centered design. And the reason why we like it is because it's very simple to understand and it's very visual. You might have seen this before, and it's composed of 2 diamonds. The first diamond is where you're doing your research and insight, and the second diamond is where you're actually designing, you're ideating, and you're prototyping. And the idea of this is that you're trying to get from a general problem to a clearly defined problem all the way up to a solution, a specific solution. And it's broken down into 4 different steps. You discover, you define, you develop, and then you deliver. Now, this is not linear by any means. You can certainly iterate and go from research and insight to ideation and prototype and go back again. In addition to the Double Diamond Framework, we wanted a way to capture our discovery process, and Jonathan talked about this earlier. There's lots of conversation that's happening throughout the discovery process, and we wanted a way or a mechanism to facilitate this conversation, and this is why we came up with what's called the product toolkit. We wanted to capture what's going on in the discovery process, as well as make it a little bit more visual and share it with the rest of the team and your stakeholders. And I'll walk you through some examples of the product toolkit as I go through the Double Diamond Framework. Now, the first step of the Double Diamond Framework is the discover step. And this is where you're diverging. The diamond is going like this, because you're doing a lot of research, there's a lot of information. And what that means in the context of UCSF is typically this is where a researcher or a faculty comes to SoundTech, and usually they already have a problem in mind. And it's our job to understand their work to date and work with them to really understand where the problem areas are. So to understand the work to date and the problem areas, we typically do what's called, we call it a literature review, but what it essentially means is that we review existing documents with them, whether that's a pilot study protocol or historical presentations around this problem area or even their IRB. So the point of this is to sort of get an understanding and get some context of where they are to date. An example of a problem statement is very straightforward. We worked with the rheumatology department on a rheumatoid arthritis project. And a problem statement that we came up with was that patients with rheumatoid arthritis are not taking their medications. And another example is, another way to reframe your problem is the how might we statement. So in the second example, we worked on a hypertension project and we used the how might we. In this case, how might we make it easier for providers to synthesize relevant data to make timely and accurate treatment decisions for patients with hypertension? Now, this problem is a little bit more specific. It talks about who you're solving the problem for and what problem you're trying to solve. In addition to laying out our original problem, we also review and lay out some of our assumptions and the questions that we still need answered. So in order to do that, we also created what's called the assumption toolkit in our product toolkit, and this is going to be available to you. And so what you're seeing here on the left is our assumptions tool. And the benefit of laying out your assumptions, whether that's typically done when you're doing your literature review or when we're doing our secondary research, is to decrease like duplicative work. So there's a ton of questions that might already be answered by just doing your due diligence and reading existing documents already. And another benefit is you can also uncover some questions that you still need answered. So for example, on the hypertension project, our assumptions were hypertension remains uncontrolled in nearly half of the affected individuals, leading to 13,000 excess deaths annually. How do we know that? We've done some digging and we reviewed existing documents. Primary care doctors also know how to treat hypertension already. And there's this concept called the clinical inertia, where doctors who are busy with a problem in front of them often miss opportunities to treat for hypertension, diabetes, and other diseases. And this tool on the right-hand side is asking questions or laying out the questions that we still need answers for, that we typically do that in our interviews or our primary research. So in the case of this clinical inertia, why are providers missing opportunities to treat for hypertension? Is it because they are too busy and they don't have a lot of time? Is it because the competing priorities? Or is it because the case might be too complex and they need some kind of support? And so in addition to all of that, we also do our due diligence and analyze the market. We have a competitive analysis tool in our product toolkit. And more importantly, in human-centered design, we also talk to the people experiencing the problems to validate our assumptions and to understand their unmet needs. So Jonathan alluded to this earlier. This is the key to human-centered design, is putting people front and center first and understanding how to address their purpose. Because most of the time, they won't care about the technology itself, but they will care about addressing their purpose. So a way to encapsulate the sort of the narrative of when we do our interviews, and the way to create sort of a persona is what's called a persona tool. So in this case, for the hypertension project, we went ahead and created a persona for a provider and for a patient. And this is also stemming from a lot of the interviews that we've already done. And what this does is it humanizes the experience a little bit by putting a face to it. And you're able to, not only the designers, but the the engineers, whoever is building it, is able to also build empathy for the people that they're designing this for and with. So in this case, you have Dr. Bob Reyes, and one of his quotes from the interview was that medication didn't work, so what do I do now? So this implies that Dr. Reyes may not have the necessary support or tools to help them make a decision when it comes to complicated cases. So after all of that research, it's time for you to do some converging and take all of your insights from the research to clearly define and get a shared understanding of the problem. One of the ways in which we do that is we usually gather a lot of our insights from the interviews, and you start to see some themes when you're doing your synthesis. So over here on the left-hand side, this is the project that I did with Dr. Christopher Peabody on the San Francisco General Hospital. And this is around billing and documentation problem. So I interviewed, I think, around 8 people, from residents to faculty to administrative directors. And I took all of my interview insights and I started to see sort of problem areas. And what this allows you to do is, you start to uncover some problem areas and some opportunities for prototyping. And it also makes you wonder whether your original problem was the correct problem to solve for. And so once you have this clear vision and once you have this problem statement, this is a clearly defined problem, one of the ways in which we communicate that is through our vision statement and value proposition tool. So on the left-hand side, it's a very simple problem statement, but it's talking about what you're trying to build, who you're trying to build it for, and why should people care about your solution. So in this case, this patient-reported outcomes dashboard exists for patients with rheumatoid arthritis in order to display reported outcomes to see how a disease progresses over time. And over on your right-hand side, you're also delving into the value proposition. Why should people care? And why should the market care? So we list out all of the people that are going to benefit from this product and what will they find valuable. So now we get to the fun part. So after all of that research, you have your specific problem that you're trying to solve, and how do you actually go from research to designing a prototype? And this is where we ideate, this is where we brainstorm answers or opportunities to clearly define problems. We also try to assess the feasibility of our opportunities because, as Jonathan mentioned, UCSF is very nuanced and we have some constraints and we have a lot of different challenges that might be different from the private sector. So it's our job to also assess whether this is technically feasible. And finally, among all those other opportunities, we also need to prioritize them with our stakeholders. So one of the fun things that we do to kind of brainstorm our ideas is to think about how this is going to play out in future scenarios. So we do this thing called scenario mapping, where we work with our stakeholders to kind of visualize how this product or how this potential solution is going to work in the context of a future workflow, because the point of human-centered design is you're actually trying to change the behavior. So what you're seeing here is a project that we're still currently working on with Dr. Andrew Bashara. He's an anesthesiologist, and he wants to use artificial intelligence to predict acute kidney injury outcomes while you're in the operating room. So we laid out different scenarios on what happens in the pre-op, intra-op, and post-op, and these blue stickies that you're seeing are areas for intervention. And I did ask for his permission, and he said yes, with a caveat of giving him a shout out. So if you want to work with Dr. Bashara on possibly publishing or implementing machine learning in healthcare, feel free to reach out to him. I put his email address here in the bottom. So another scenario example, this is for our rheumatoid arthritis dashboard. Again, this is done by Cynthia, and every designer has their own way of doing scenarios, but the point of this is that you're laying out your future cases, or you're visualizing how this product is going to work within the context of a certain workflow. And this is one of my favorite parts of human-centered design, is we're actually co-designing with our stakeholders from the very beginning. We're co-creating with them. And over to your left-hand side, you see Dr. Peabody and his team over at the Zuckerberg San Francisco General. This is called the Waiting Room Project, and you can see they're super engaged. I love working with our stakeholders because they feed off of each other's energy, and it's helping them use the different part of their brain when they're actually physically standing up, and this contributing to ideas leads to this co-creation and shared accountability for the success of the project. And finally, now that we have all of those ideas and we prioritize them, it's time to test out different solutions at small scale. And this is where prototyping comes in handy. Jonathan talked a little bit about different fidelities of prototypes. You have your low fidelity, medium fidelity, and high fidelity. And this is used all throughout the discovery process. It just depends on the kind of feedback that you want to get. Again, a low fidelity is something that's very inexpensive. You can do it right away. You can be pretty scrappy with it, and it doesn't cost a whole lot because you're not coding anything yet. Once you get to a more polished fidelity, medium and high fidelity, this is where you're maybe testing out the interactions, or testing out the different elements or different features that could interconnect with certain technologies here at UCSF, such as the electronic health record. And now I'm going to pass it on to Lana to walk us through a specific case study and talk about the minimum viable product.
Thank you, Anna. It was awesome. I'm Lana Milter, Business Solution Architect for Sumtech, and I'd like to share with you an example of one of the complex projects that our team implemented by using human-centered design principles. Remember COVID? We had a deadly, rapidly spreading disease at our hands with no concrete understanding how to control it. We had, many of us were on a lockdown. CDC required us to wear the mask, sanitize, and report our symptoms on a daily basis. COVID symptoms, exposures, positive test results, to get a clearance entry, to get at the doors, to enter UCSF premises. Army of nurses at occupational health system worked around the clock to triage incoming calls, to assist with the COVID-related cases. And by the time our team received this project, a vendor solution was already in place. The vendor solution called Conversa was used by our employees, but it had major limitations. It was costly. It didn't have integration with our internal systems. It was limited on the reporting, and CDC requirements were rapidly changing. So we needed to update this screening logic continuously and consistently, and it was really hard to do on a vendor's product. We used three main principles of the human-centered design. It's to celebrate constraints, to make things tangible, and to work with and for our stakeholders. So when you passing through the design phase and entering the prototyping phase, there are a few main documents or that we are creating as a transition from the design to the development phase, and those are system diagrams. Why is it important? Because it allows us to make few strategic decisions How easily can we integrate? Will our solution scale? Can we adapt to changes rapidly? And can we maybe extend it, God forbid, to other diseases if needed? So the system architectural diagram and the data flow diagram, those are the primary documents that we are generating in the design team to pass it through the development. The data flow diagram, it's a very important artifact that we're creating. We treat data on any digital product as a currency. So through the data flow diagram, we can answer the questions, is the data exchangeable? Are there any limitations? Can we, is our data protected and secured? Because those are important questions. And then as a next phase, we are doing the MVP definition. And to do this, it's very similar to what Anna described in a visual storyboard, but now we call it a service blueprint. It's a technical storyboard when you link your personas and your journeys in actionable steps and defining your process end to end. I forgot, let me make one step back and tell you one important thing right here. It's the message that I wanted to communicate, that when you design your system or service, don't treat it as a single point solution. What's important to remember that your solution will be a part of the larger ecosystems. That's why these artifacts are super important. And when you define your MVP, a successful MVP should be small, quick, and cheap. Don't look at it as a small segment. Outline your end-to-end process from the beginning to end, because this is where you will benefit to create this critical flow or determine what are the critical features that are important for your functional prototype or functional product. When you mark or define your happy path or critical features, it's important to go through the prioritization mode and prioritize your features based on the value and effort needed. I want to zoom in and give you just one example of the simple feature that made it to the MVP of the digital health screener. It's an email alerts and notifications. It's very important to remind an employee to complete the digital screener. So it's an SMS or email alert. It was prioritized as a high value. We knew how to implement it, so the effort needed was medium. But then you have this area where you defined your acceptance criteria. And this acceptance criteria, it's your step to outline a high-level requirements. And you can truly, we encourage you to start small and simple. And those criteria, like send a daily alert, send a reminder daily. But then as you iterate through your MVP, you improve your feature. And in phase one, what we've done, we used user settings where user can set up whether they want to receive reminders daily or weekly or at the time when they're coming to work. And in phase two, when we merged the batch data with our screening entries, we were able to alert the individuals after they entered the UCSF premises. Make things tangible. This is where you are converting your ideas to the working prototype. And when you're in a time crunch, you don't necessarily need to start with a low fidelity or medium fidelity mockups. You can immediately jump to the high fidelity mockups. And we had a designer on our team, Anna, who did generate those wonderful mockups for us to iterate. And when you, again, need to deliver quickly, don't have time to invest in a clickable prototype to get the user's feedback, what you can do is just to visualize your navigation flow and see what will happen when you click on this button, what screen will appear. And this is an opportunity for you to get a rapid feedback. As you can see, we started small, we captured feedback, and we generated this final screens, which I'm sure everyone is familiar with. As Jonathan mentioned, to success metrics, it's a front and center when you're designing your MVP. Those needs to be quantitative and qualitative. So you need to put an exact parameters of how you're gonna measure your success. And it's either the cost saving for us to, so one of the reasons why we, or the decision was made to implement the internal tool was that the vendor was trying to charge us $75,000 per each translated language on the tool that they gave us for usage. And this was the cost saving measurement that we've done or helped with, but what is the best way to show up and measure your success? It's through the analytics. So now that you build that integrated system and you have data available at your disposal, you can fine-tune and use the data points that you want to present for your success measures. And we built a command center dashboard, as we call it, where we monitor the daily screening rate. We were able to generate the compliance rate through the institution overall. We sliced and diced the data to show the data or screening compliance by control point, by department, and even generated the list of employees who were disobedient, or as we call it, a Nazi list of employees who didn't complete the screener. Roadmap, it's where you start thinking beyond your MVP, right? It's where you merge your short-term and long-term goals. And it's a living document that helps you to translate your short-term tasks and align it with your long-term vision. And by including the roadmap in our design or development phase, allowed us to iterate on the product and deliver the product in a small iteration. So the phase one it's when we build this integrated system and replaced the vendor's product. The second phase, we called it enhancement, when we brought in the batch data. So now you don't necessarily need to know, did you complete the screener or have this other system that controls your compliance. Employees come to the door, and if within the next 2 hours you didn't complete the screener, then email will go to employee and notify possibly supervisor that on this day you missed the mark. And the final principle, human-centered design principle, is to work for and with stakeholders. And we ask 3 important questions: what, who, and how. What are your stakeholders? Who are your stakeholders? What do they care about? And how influential they are. And we mapped out our stakeholder list and involved them in the discovery and prototyping phase. We are an agile shop, so we have developers who are working with the design team to prototype the product. And we are using their expertise and going through the demonstration of the phases of the prototype that we built And before we are releasing, we are passing the product through the rigorous testing exercise when we are involving all our stakeholders. Why I have that red star next to one name, it's because in the agile development phase, you would like to have one voice that represents all your stakeholders, and this is the person who played this product owner role. And I'm just very proud to say that we not only delivered the product, but we met all the important goals of this product. We saved the cost, we simplified the workflow, and we decreased the infectious risk by creating the analytical tools to make the process more transparent. And we did it by being agile, iterative, and strategic. And just to wrap up my part of the presentation, I wanted to share with you the diagram that represents the way we work. We are successful because we are combining together human-centered design, lean startup, and agile methodology. And we are using human-centered design mostly in a discovery phase when you are evaluating pain points, defining the problems, and proposing the solutions. So this is where you define and ideate. We are cycling through the lean startup when we are prototyping and launching the product on a small scale, defining the MVP, assessing the human behavior either through clickable prototypes or through the user storyboards. And once we are entering the development phase, we are using the agile development method to work in a small batches and to focus on a high priority tasks to deliver a shippable product. And I would like to introduce and to ask Cynthia to come to the podium and share some resources that we would like to share with you that will help you in the future design and development phases.
Thanks, Milana. You've heard us, hello innovators, first of all, and thanks team. You've heard us mention these tools and you've seen lots of examples of these tools. These are completely available. A lot of them are adapted from things that already exist out there on the web, but you can find them on SOMTEC's website. All you have to do is go to toolkit.ucsf.edu and everything is there. Everything you've seen presented exists in our toolkit. It's no secret. Once again, that's toolkit.ucsf.edu. And these are meant, as Jonathan said at the very beginning, these are exercises to be done with the team so you can have discussions and conversations. And these are not to be done in any specific order. They're to be done at the right time when you're assessing whatever needs you're looking at. And if you've heard the word living document and you're like, what are they talking about? They're meant to be updated. They're owned by everybody, not just one person. This is an example of the persona that Anna showed earlier. This is the page. So every page has a little bit about this conversation to guide you about the conversation you might have with your stakeholders and your team. There's a little bit about it. There's resources that link off to dig deeper. And you can print this out as a PowerPoint, Excel, or Google Sheets and share it as much as you like. But there's examples of all of them here as well. So it looks like this. All of these you can click through. Hopefully you're familiar with this terminology by now. We have the personas, so those are like your needs and goals and motivations of your users, right? The scenarios are kind of the narratives, which might look like a storyboard. You saw different variations of that. They might show how a tool fits into the workflow or how someone might use the product. So you're kind of imagining, right, the future. There's the what we know and don't know. And this is, as we've said several times today, super important because this can help you like drive your research plan. When you know what you don't know, you can go research it. that MVP, that triangle you keep seeing, so you can build quickly and test and iterate and provide the most value. The competitive analysis, because something we really hate is when we see the wheel recreated. Like, just make sure it doesn't already exist, or you're really going to be wasting time. The vision statement and value just helps to align everyone towards the same goal. Same with success metrics and just having an understanding of how you're going to measure the impact of something. That product roadmap with the long-term and short-term goals and how you're going to try to get to them. And all of this can help you set up a design research plan so you kind of understand what your path forward is. What are you going to research? What do you need to learn? Going into something without a plan, you might fail, and you need a timeline and a budget, and they're hard to put together, but they're well worth it. And toolkit.ucsf.edu, this is my entire thing up here, so I'm done, but we're gonna have questions, and I'm gonna encourage the remote folks to stay on because you were told there's gonna be an activity today, and we have a remote activity planned, which we think will be very fun. So you can leave if you must, but you will really miss out. So we encourage you to stay. And I know we're gonna ask questions. Are you coming back up here? Great, thanks.
Wow, that was an incredible session. Fortunately, it's recorded, so we can use that as a reference. But also, I want to point out that this team is available to you. So you can start using the toolkit, you can use the forms, you can get familiar with the process. You can also engage with this team for 8 to 10 hours before the clock starts ticking on the recharge rate. And that is an incredibly valuable resource that most of us faculty and frontline innovators here don't know about, and the trainees or learner innovators. So keep in mind that you have access to this wealth of knowledge here, and their ability to help you navigate something that's foreign to us. We don't get trained in this. The terminology can be foreign. But once you start learning the processes and experiencing them, you're going to start looking at your problem ideation very, very differently. And we are always trying to make things better because we're experiencing them in our labs, in our clinics, in the OR, and always thinking, oh my gosh, can't we just do this a different way? So you're going to start thinking about how do you come up with those solutions by using design thinking way up front. We have the opportunity to actually experience this for the people here in person. We'll have an opportunity to walk through a scenario, also the people on Zoom. I thought maybe since we have this incredible guest with us tonight, Dr. Han-Min Lee, he's the inventor of SmartDerm. And it was his invention and his team, and this is it's been disclosed at UCSF. And what is very amazing is that this whole team has been working on how to develop a user interface that would make this usable. And instead of me explaining it, I'm wondering, Han-Min, if I could call on you to give us your tagline about what you came up with and why. What's the problem, and then and even if you want to say where has it met friction, you know, where is it stuck now? Do you want to come up and talk about it, or you want me to bring you a mic?
Wasn't preparing.
No, I know that, but I just know you've lived it for so long that if you give us a 1 minute, or that would be really great. Much better than me translating it.
Thanks, Ainor, and thanks for the invitation. I guess the journey for me starts with the fact that I'm a failed basic scientist. I came here to do basic science research, and several things conspired. A couple of my collaborators left, and two of my partners, one of them left, and one of them went on sabbatical shortly after I joined UCSF, and then I went from having some protected time to working 120-hour clinical weeks again. And I think that was actually the best thing long-term for my career, because I think that I probably wasn't best served being a basic scientist. And where I think I thrive is in innovation in clinical medicine. So we started a little club with, some of the people that I admire the most. And Einar was a part of that. And we just started thinking about how we could innovate. This goes back 17, 18 years. And at that time, if you said you were an innovator here, it was kind of like not a good thing, I think, unless you were doing basic science research. But one of the things that I landed upon was I think it was 1999, the federal government, the Centers for Medicare and Medicaid Services, said that they would stop reimbursing hospitals for never events. And never events were those sort of critical errors in medicine that should never happen. And I thought, oh my God, this is just going to change payments in medicine and everybody's going to jump on this. And basically nothing happened for years and years and years. And it just shows how slowly medicine moves. One of the things I thought was most interesting is the concept of pressure ulcers or pressure sores or hospital-acquired pressure injuries, all synonymous terms. And I thought, well, we can prevent these things. I mean, this is not like advanced technology. And so very early on, we came upon a 3-tiered platform of, and I should say parenthetically, that the way that hospitals measured people at risk for developing pressure ulcers was like a 40 to 50-year-old assessment tool called the Braden scale. And one of the things of the Braden scale is to assess nutritional, and this is still used now, to assess nutritional status of the patient was how much food there was left on the patient's tray, not accounting for the fact that, maybe some of it's on the floor, maybe the family members ate it, et cetera, et cetera. So that's the state-of-the-art nutritional score. So we thought, well, they're pressure ulcers, so we should start measuring pressure. And then once you start measuring pressure, well, it's a whole new biomarker. And then you need to be able to quantify it. So you need to be able to assess it. And then once you assess it, then maybe there's an opportunity to put something into effect that will actually alleviate the pressure in an automated fashion. So it was sort of a closed loop system, sort of. Now I realize how aspirational it was. At that time I thought, oh, this makes perfect sense. This is like 13 years ago. We're just going to solve this problem in like a month. And of course, maybe it's not 13 years, maybe more like 10 years. And we've had many ups and downs and lots of pain points. But anyway, that's the story of this. And currently we've collaborated with many different teams, and we still, we have a patent on it, but we've never gotten to a MVP. We've used human-centered design principles in many of our research efforts on this. I just got an email over the weekend from a collaborator at UC Santa Cruz trying to figure out how we advance this. We've written some grants on this. I think it's a really good example of how it's a good idea, but we haven't figured out the product yet to actually fix the problem yet in a way that will work in the real world. So anyway, that's my story.
Thank you. I think that just set the stage beautifully for us, Hanmin. And before we break into our little groups, I would really like to thank our panel of speakers from SomTech. I really appreciated that. We've recorded it. This is going to be part of our Digital Resource Center for Innovation here at UCSF. So thank you very much. I'll just give you one more round of applause. All right. For those in the room, we still have food, and we were going to migrate up to the Innovation Lab up at 227, and the others on Zoom can proceed on with the facilitator here. And again, we're going to regroup June 18th for session number 3, and you'll be getting flyers about that. So thank you very much.
We got it. Hi, sorry, there's some movement behind me, but can you all hear me?